Glyphosate's interesting. It's been abused in the world for many, many years. I believe it's pretty radically used in the country of Australia now. Since 2006, I believe you guys started buying glyphosate from China and using it in radical amounts. The problem with glyphosate is that it is a chemical or a organophosphate that is water soluble, so it tends to go everywhere. It's also a chelating agent, so it pulls metals out of just about everything. So it pulls all the minerals that people need for their health out of the food supply. So people are finding less and less minerals in their food supply, therefore they cannot have the building blocks for health. And the biggest problem with it is the fact that we're using it as a desiccant. So that means that we're spraying, these pesticides on foods that we want to harvest earlier because we want to get the food out to the world quicker, or enhance profit. And that is putting that organophosphate on our food supply, and that is a really disastrous issue. What are we doing about the glyphosate exposure currently? There's some research currently in the US done by Dr. Zach Bush, where he has used a lignite extract that has been helpful, but we really don't know what to do with it at this particular point. The only way that you can really compensate for this is whatever you're lacking, you have to substitute. Because it is pulling minerals out of the system. It's also affecting the aromatic amino acids. And these aromatic amino acids are the tryptophans and the tyrosines that convert to dopamine and serotonin. So, once again, the only way that you can really compensate for some of that stuff at this particular point is proper supplementation. As far as pulling all the glyphosate out of the world and the food supply and the water and the shower water, we're looking at a big issue there. We don't really have the answers on that, which is kind of a scary thought, but at this particular point, that's really what we know. And cleaning up the act, staying away from the foods that are being sprayed with the product as a desiccant. Eat as much organic as you can because it's helpful. We've run some glyphosate tests in my office on patients, and everybody tests positive. There's levels of it, but it's pretty much out there for all of us at this point. Yeah, I work with a tremendous amount of intestinal permeability cases where if you clean up the act of the diet, try and get them away from as many of these glyphosate foods as you can, and then you give them supplementation at a reasonably aggressive dose, you definitely can see improvement in those cases most of the time. So intestinal permeability is something I think any kind of integrative practitioners working with today. I think because we are the only people that people come to for answers, because nobody can figure it out because it's chronic, and you can't point the finger at exactly what it is. But in clinical practice on a daily basis, if I have to say that there's one particular case that stands out, there isn't, because I'm working with so many IBS cases and IBD cases, and from a foundational standpoint, the only thing that I can say is, in my own opinion, I feel there's levels of intestinal permeability, and that's not really been written about or published much, but I believe that if I look at my patient base, some patients react to everything that they eat, even real good quality food, and that's a severely permeable person, because even the antioxidant rich and healthy and healing foods are actually causing an inflammatory response that's so strong in that person's body that they actually have a negative reaction to it. And those particular cases is very, very slow progressive steps. Some people, when you just remove the glyphosate and the herbicides and the desiccant sprayed or oversprayed food groups, you see improvement immediately, because if they're not severely compromised, then those aromatic amino acids start to convert properly. They're starting to get the minerals and the vitamins back in the food supply and into their systems, and they can absorb it again. And that's obviously the level one permeability in my opinion. When I get to that level of patient, severely permeable patients, I'll actually do some additional testing. Apart from GI mapping where we're looking at the biome, I will also do intracellular nutrient testing. I will do organic acid testing, because I want to determine which of the pathways have been affected from the energy standpoint. I want to look what your intracellular status is of glutathione and vitamin C and vitamin B6. And so it becomes a very individualized case at that particular point. And what we generally see are most of the important minerals being depleted. We see a tremendous amount of iron deficiency anemia in people that use a lot of the glyphosate products, because I know people are always pointing the finger at gluten, and I'm a big believer in Dr. Fasano's research in gluten. But you know, if you look at some of the research of some of the more published people in glyphosate, you'll see that they actually have the same villi atrophy from glyphosate use in other products that you get from gluten and celiac disease. As far as what I use for these people, well, anything that you can put your hands onto that they're deficient in, you know, so I clearly would give them the B complex that we use. I'm a big promoter in all people, not just people with intestinal permeability, on all the Evail products. Evail is phenomenal when it comes to any kind of glucose regulation and insulin control and lipidemia issues. The liposomal glutathione is something that I use all the time because I believe that a very overlooked aspect of health in our world is the overabuse of alcohol. And alcohol has a tendency to deplete one of the major antioxidants in the body called glutathione, so the liposomal glutathione is definitely something that I utilize. And by the way, alcohol is one of the biggest creators and irritators of permeability. Very unknown fact, but if you drink excessively, you're actually causing tight junction permeability.